In spite of 1 out of 5 healthcare dollars spent on diabetes, the epidemic keeps growing. And the grim statistics around death and complications only get worse. Beyond medication and diet, there is a constant search for practical interventions that will make a real difference in the war against diabetes. And it's clear that just being told what to do doesn't work.
Over the years, all the health practitioners, the nutritionists, the doctors, they were all right. Everything that they said was absolutely correct. But I really don't think I was putting it together. It's almost like a war that everybody was fighting in, except me.
The struggle is universal. Dr. Margaret Ruckstalis faces the challenge of motivating patients daily.
We see people who are really afraid of their disease, and so they want to ignore it or put it aside, not pay attention to it. As a professional, I search the medical literature, and there are 4,000 or 5,000 articles on diabetes each year. It's just so much information, and it's chaotic.
Dr. Ruckstalis works at Geisinger Health System in central Pennsylvania, a diverse region, and like everywhere in America, there is a large population challenged by diabetes. Don Leas is a factory worker from Bloomsburg, Pennsylvania, who's lived with type 2 diabetes since 1996. He's had A1C levels as high as 9.7 and admits diabetes has been a constant personal battle.
For 15 years, I've been trying to do the right thing, trying to eat the right things and cut down on my portions and all the wrong things that I do, but it's been a struggle.
But everything changed about a year ago when he opened a letter from Geisinger Health System. Geisinger is a trend-setting multi-site health system that serves 42 counties across central Pennsylvania.
President Obama has mentioned Geisinger, and we've been in the news quite a bit about disease management.
Don was one of 166 people selected for a unique diabetes study conducted by Geisinger with dLife.
Well, the reason I joined the study is over a period of time I've been diagnosed with diabetes, but for some reason I couldn't get it under control. And actually at my age, 64, I started to go the wrong way.
The new Diabetes Day study set out to test a simple but promising idea that providing people easy, on-demand access to a highly practical diabetes lifestyle resource would improve their motivation and ability to care for themselves. All participants had above-average A1C levels. The study group was given 24/7 access to a flow of pragmatic diabetes learning, such as a personalized website and email, along with regular doctor visits. A control group received only the doctor visits. The results in the dLife group were compelling.
Diabetes was a struggle for me because I really didn't understand what it meant, and I didn't know how to do anything about it.
Along with the website, Don and the other study members received other practical tools and reminders.
It's been great getting some tools so that you can control the diabetes instead of letting it control you.
But it was the ease and organization of the online resources that clearly made the biggest difference.
It kind of puts everything together. You got bits and pieces over the years. It puts it together, and then you start thinking, well, now it makes sense. The fact that it's available 24/7 over the computer makes it flexible, and it fits into my lifestyle, and it would probably fit in with anyone's lifestyle.
This study is the first one that I can remember and aware of, where we take the growing knowledge that's out there, both for providers and patients, and the individual, and bring it together in their own homes, on their own schedules.
The program was designed to engage the participant by serving as a constant companion or support system. It recognized the motivational power of making the diabetes learning process involving and fun.
My only problem with dLife was I couldn't get off it at night because I'd start in one section, do the quizzes, of course, Okay, into the menus, and then I've got to chat with somebody. And it just, you know, sometimes I looked, it was 2 o'clock in the morning, and I just loved it. And I really enjoy the website.
I can go to the other people's stories and to the forum and interact with other people who are also diabetics.
Exposure to dLife TV videos were also part of the study, and some familiar dLife faces struck a chord.
Jim Turner is a teacher, and he relates to you.
And I will sit and have coffee and talk to people for hours about shots and pumps and meal planning and what's a pain in the ass and chocolate.
The things he said, I chuckle and I think, oh, he hit that right on the head. That's me.
Me saying I need you to test 3 times a day seems very different than if you see a group of skiers who are testing as they go.
Those young people testing before they skied and so they could do a normal life, it just kind of opens it up like this is not a secret thing. This is diabetes, I have it, and I have to face it.
Most importantly, the study showed patients that doctor visits simply aren't enough.
It's great to go to a doctor, and they do help you. But this study, it's almost like after I've gone through it, I have some friends that can stand alongside of me anytime, and they're available anytime. It's almost like constant maintenance. In a sense, dLife stands alongside of me 24/7.
After 6 months, the participants returned to measure results and share their stories, proving knowledge really is power.
I feel much more in control.
So many changes have occurred that my doctor is absolutely amazed. And he said, "What are you doing, woman?"
When I started this study, I was shooting 35 units of insulin at night and 18, 20 in the morning. And I'm down to 8 in the morning and 10 at night.
My doctor got on the computer and looked at my weight loss. She goes, "Woohoo!" And I gave all the credit to dLife.
And as my wife said to me, "You're not as grumpy."
My cooking habits have changed. I'm eating better.
I can't thank dLife enough for having the opportunity to be involved in this study.
On average, dLife study participants had much lower A1C levels, lost more weight, and scored higher on diabetes knowledge tests, among other improvements. But for Don, the benefits go way beyond the numbers.
I want to be here to enjoy my family a little bit longer. I'm 64 years old, and I have 2 grandsons, daughters. I have a family, and I love them very much. Life is short. It's like a breath, and then it's gone. This is life and death. I have to take control of it.